If you're over 55 and your feet tend to go numb at night, you're not alone. This is a surprisingly common experience, yet it's often misunderstood or brushed off as just getting older. In reality, nighttime foot numbness is usually not random, and it's not something your body does without a reason. This video is not about diagnosing any condition. Instead, we're going to look at this issue from an educational perspective, focusing on circulation and nerve health, two systems that naturally change as we age, especially in the lower body. The feet are often the first place where these changes become noticeable, particularly when the body is at rest. Numbness that shows up at night is a signal. It doesn't automatically mean something serious, but it is your body's way of communicating that certain processes may not be working as efficiently as they once did. Understanding that signal is the first step toward protecting long-term comfort, mobility, and overall health. Before we continue, please note that this video is for educational purposes only and is not medical advice. Symptoms like nighttime foot numbness can have many different causes. For proper evaluation, diagnosis, or treatment, always consult a qualified healthcare professional who understands your personal health history. To understand why feet often go numb at night after the age of 55, it helps to first understand how the feet normally stay warm, sensitive, and responsive. Your feet rely on two critical systems working together: nerves and blood vessels. Nerves carry signals between the feet and the brain, allowing you to feel pressure, temperature, and movement. Blood vessels deliver oxygen and nutrients that keep those nerves healthy and functioning properly. When either system becomes less efficient, sensation is usually the first thing to change. As we age, nerve communication naturally slows down. The protective coating around nerves, called myelin, can thin over time, making signals travel less smoothly. This doesn't usually cause pain at first. Instead, it often shows up as subtle numbness, tingling, or a dead feeling, especially in the toes and soles of the feet. Because the feet are farthest from the brain, they are often the first area where age-related nerve changes become noticeable. Blood flow also changes with age. Arteries and smaller blood vessels may become less flexible, making it harder for blood to travel efficiently to the extremities. During the day, regular movement helps push blood downward and back up toward the heart. At night, when movement stops, circulation naturally slows. For some people, this reduction in blood flow can be enough to temporarily limit oxygen delivery to the nerves in the feet, contributing to numbness. Nighttime itself creates conditions that can amplify these changes. When you lie down, gravity no longer helps circulate blood to the lower legs and feet. In certain sleeping positions, blood vessels can also be slightly compressed, further reducing circulation. Even small reductions can matter when nerve function is already less efficient due to aging. Body temperature plays a role as well. Core body temperature naturally drops during sleep as part of the normal sleep cycle. When that happens, the body prioritizes keeping vital organs warm, sometimes reducing blood flow to the hands and feet. Cooler temperatures cause blood vessels to narrow, which can further limit circulation to the nerves. This is why numbness often appears or becomes more noticeable late at night or in the early morning hours. So metabolic health is another important piece of the puzzle. Nerves are, highly sensitive to changes in blood sugar and nutrient delivery. Over time, frequent blood sugar fluctuations can affect how nerves respond to signals, even in people who have never been diagnosed with a metabolic condition. These subtle changes may not cause symptoms during the day, but at night, when circulation slows and nerve signaling is already reduced, they can become much more noticeable. Inflammation also tends to increase slightly with age. Low-grade, chronic inflammation can affect both blood vessels and nerve tissue, making them more reactive and less resilient. This doesn't happen overnight. It builds slowly, which is why numbness often seems to suddenly appear later in life, even though the underlying changes have been developing for years. When all of these factors come together, slower nerve signaling, reduced circulation, nighttime positioning, cooler body temperature, and metabolic sensitivity, the feet become especially vulnerable during sleep. The numbness you feel is not random. It's the result of multiple systems working less efficiently at the same time. Understanding this process is important because it shifts the focus away from fear and toward awareness. Nighttime foot numbness after 55 is often a functional signal rather than a sudden problem. By understanding why it happens, you can better appreciate why long-term support for nerve health, circulation, and overall metabolic balance becomes increasingly important with age. To go deeper into nighttime foot numbness, we need to look more closely at peripheral nerve health. Peripheral nerves are the nerves that extend from the spinal cord out to the arms, hands, legs, and feet. Because the feet are the farthest point from the brain and heart, they depend heavily on efficient blood flow and strong nerve signaling. Even small disruptions tend to show up there first. This is why changes in sensation often begin in the toes and slowly move upward over time. One important factor in circulation efficiency is a molecule called nitric oxide. Nitric oxide helps blood vessels relax and widen, allowing blood to flow smoothly through even the smallest vessels. As we age, natural nitric oxide production tends to decline. When this happens, blood vessels may not expand as effectively, particularly in the lower legs and feet. Reduced circulation means less oxygen and fewer nutrients reaching the nerves, which can weaken nerve function and contribute to numbness, especially during long periods of rest like sleep. Chronic low-grade inflammation is another common contributor. Unlike acute inflammation, which is short-term and protective, low-grade inflammation can quietly affect tissues for years. It can irritate nerve endings and damage the lining of blood vessels, making circulation less efficient. Over time, this creates an environment where nerves become more sensitive, slower to respond, or less capable of sending clear signals. In the feet, this often feels like tingling, numbness, or reduced awareness of touch. Blood sugar fluctuations also play a role in nerve sensitivity. Nerves rely on a stable energy supply to function properly. Repeated spikes and drops in blood sugar can interfere with how nerves generate and transmit signals. Even in people without a diagnosed condition, long-term blood sugar instability can stress peripheral nerves. At night, when circulation slows and the body is fasting, these effects may become more noticeable, making numbness more likely to appear. Nutrients are a key part of supporting both nerve function and circulation. B vitamins are especially important for nerve health. Vitamin B1 supports energy production within nerve cells, helping them send signals efficiently. Vitamin B6 plays a role in neurotransmitter production, which affects how nerves communicate. Vitamin B12 is essential for maintaining the protective covering around nerves. Low or suboptimal levels of these vitamins have been associated with changes in sensation, particularly in the hands and feet. Magnesium is another nutrient closely tied to nerve and muscle function. It helps regulate nerve signaling and supports relaxation of both muscles and blood vessels. Adequate magnesium levels can help prevent excessive nerve excitability, which may contribute to nighttime tingling or numbness. It also supports healthy circulation by helping blood vessels maintain a relaxed, flexible state. Omega-3 fatty acids contribute to vascular and nerve health in a different way. They help support the structure of cell membranes, including those of nerve cells, and play a role in managing inflammation. Omega-3s are also associated with healthier blood vessel function, which supports steady blood flow to the extremities. Over time, this combination may help create a more supportive environment for peripheral nerves. Research on aging and nerve health consistently shows that peripheral nerves are more vulnerable to age-related changes than central nerves. Studies have observed gradual reductions in nerve conduction speed, blood vessel flexibility, and nutrient delivery to the extremities as people age. These changes tend to develop slowly and may not cause noticeable symptoms until multiple factors overlap. Importantly, research also suggests that lifestyle, nutrition, and long-term habits can influence how strongly these changes are felt. While aging itself cannot be stopped, supporting circulation, reducing inflammation, and providing the body with key nutrients may help maintain nerve function and comfort over time. This is why nighttime foot numbness is best viewed not as a single problem, but as a reflection of how multiple systems are adapting with age. When it comes to supporting nerve health and circulation, the most effective strategies tend to be practical, gradual, and consistent. There is no single action that works overnight, but small daily habits can create meaningful support over time, especially after the age of 55. Nutrition plays a foundational role. Whole foods that naturally support nerve function and blood flow should form the base of daily meals. Foods rich in B vitamins, such as leafy greens, legumes, eggs, and whole grains help provide the building blocks nerves need to function efficiently. Fatty fish, nuts, seeds, and olive oil supply beneficial fats that support blood vessel flexibility and help manage inflammation. Mineral-rich foods like leafy greens, avocados, and beans contribute magnesium and potassium, which are important for healthy nerve signaling and vascular tone. The goal is not perfection, but consistency in choosing foods that support long-term circulation and nerve resilience. Hydration is often overlooked but equally important. Even mild dehydration can reduce blood volume, making it harder for blood to reach the extremities. Staying adequately hydrated throughout the day helps maintain circulation and supports nutrient delivery to the nerves. This becomes more important with age, as thirst signals tend to weaken over time. Daily movement is one of the most powerful tools for promoting blood flow to the feet. Gentle, regular activity encourages circulation without stressing the body. Walking, light stretching, or simple ankle and calf movements help activate the muscles that push blood back toward the heart. Movement during the day also supports healthier nerve signaling by increasing oxygen delivery and reducing stiffness in the lower limbs. Long periods of sitting can allow blood to pool in the legs, so brief movement breaks throughout the day can make a noticeable difference. Sleep habits matter more than many people realize. At night, certain positions can either support or restrict circulation to the legs and feet. Sleeping with legs tightly bent or with heavy bedding pressing on the feet may slightly reduce blood flow. Some people find that keeping the legs in a neutral, supported position or using light bedding allows for better circulation. In some cases, elevating the lower legs slightly can help promote more even blood flow during sleep, though comfort should always come first. Temperature also influences circulation. Keeping the feet comfortably warm at night can help blood vessels remain more relaxed, supporting better blood flow to the nerves. This does not mean overheating, but avoiding cold exposure that causes blood vessels to narrow. Simple adjustments, like breathable socks or maintaining a comfortable room temperature, can be helpful for some individuals. Consistency is more important than intensity. Quick fixes and extreme approaches often create short-term changes without addressing the underlying factors that contribute to nighttime numbness. Nerve and circulation support works best when healthy habits are practiced daily and viewed as part of long-term self-care rather than a temporary solution. It's also important to pay attention to broader health patterns that influence nerve sensitivity and circulation. Factors like sleep quality, stress levels, and energy balance all affect how nerves respond, especially at night. Managing these areas doesn't require drastic changes, but it does benefit from awareness and gradual improvement. Finally, while lifestyle and nutrition can provide meaningful support, they work best when aligned with professional guidance. If numbness persists, worsens, or begins to interfere with balance or mobility, discussing these changes with a healthcare professional is an important step. Supportive actions are not about replacing medical care, but about giving the body the best possible environment to maintain nerve health and circulation as it ages. To summarize, nighttime foot numbness after 55 is usually not random. It happens because nerve signals slow with age, circulation to the extremities becomes less efficient, and the feet, being farthest from the heart and brain, are often affected first. At night, reduced movement, cooler body temperature, and sleep positioning can make these changes more noticeable. This kind of numbness is a signal, not something to panic about, but not something to ignore either. It's your body's way of indicating that nerve health and circulation deserve attention. By supporting your body with consistent nutrition, daily movement, healthy sleep habits, and professional guidance when needed, you can take meaningful steps toward long-term comfort, balance, and mobility. Awareness and prevention, practiced steadily over time, are often the most powerful tools for healthy aging.